For the patients that they want to have more cleavage, they fall into two different categories. Patients that have gone through the implant augmentation and they have a larger breast but did not address their cleavage properly. They still have big gap and they want to fill. Even though they put a bra on, they feel like that this cleavage is not as good as it can be. So for those patients, I offer them fat grafting for cleavage therapy to enhance their cleavage, and that can be done over the implant. We don't have to do anything about their implant. They're just gonna do fat grafting over the implant for cleavage. The other category of patients are those patients that don't want to implant. They're not interested in larger breasts, but would like to have a cleavage. They would like to have a more fuller cleavage area and the breasts much closer together. Or there's patients that they complain about having the wrinkle in mid-chest, and for them I offer fat grafting alone without doing an implant, and that can be done under local anesthesia for cleavage enhancement. It is something that I noticed when I started in fat grafting that can be achieved predictably and easily. One of the shortcomings of the implant in patients that they have very flat chest, or the pectoralis muscle origin is very separate from the sternum. For those patients, when you talk about the implant, there's a gap, and then some ladies, they would like to have much better cleavage, and going larger is not going to solve that problem. The only way you can fix that is enhance the soft tissue over the implant and just address that cleavage part, and I call it cleavage therapy. They're just fat graftings performed for cleavage enhancement, and you don't have to have big surgery. You don't have to do anything about the implant, but you can just do fat grafting over the implant for the cleavage enhancement. I have some patients that come to me because they have implant and they're not happy with their cleavage, or there are some patients that they don't want to go be very large. They don't want to go to C or D cup, but they want to have a better cleavage when they put the bra on. And I start doing the fat grafting just for the cleavage enhancement, and I call it cleavage therapy because you kind of target a very specific area. And this is for the patients that they're happy with the size of breast, but they're not happy with cleavage. And I use the fat grafting to enhance their cleavage and make it a little bit more fuller. And the other thing is also I've noticed some of this patient is that some of the patients, the age, they start having the wrinkling at the sternum. When they put the bra on, they see the wrinkling. And I use the fat grafting for that area that has worked very well to enhance that area, so you don't have that line as shown at the chest.